Good morning, friends. Let us start another section of the another part of alcohols and disulfiram. In the previous section, we discussed about what is alcohol, what are types of alcohol, how it is absorbed, how it is metabolized, and what are the synthesis that is available, and that was all discussed in the first part. And according to that synthesis of metabolism, with your absorption and the metabolism, we were discussing about various drugs that perform the action of some blocking so that the symptoms may not enter into your blood circulation. So today I told you this disulfiram is one of the best and potent drugs which are used for this type of purpose. And as we saw the synthesis over here, just I'm mentioning you the mechanism of action of disulfiram in aromatically, so that it will be very brief to understand and also very easy and clean to represent onto a paper, so that the person who sees it will show the attraction of how we present our mechanism of action. And this is a very simplified form and easy pharmacology to represent like this. So we made our section as pharmacology made easy. And now we'll see what is happens here. This is disulfiram, and we already know that it is acting on, yesterday we were discussing in the previous section, it is acting on aldehyde dehydrogenase, which is nothing but called as ALDH. And this is the third step in the formation where the alcohol dehydrogenase is performed into acetaldehyde. That means this acetaldehyde has been already prepared and this is entered into your blood circulation. And this aldehyde dehydrogenase is used to prepare acetate. That means we are blocking this enzyme so that the acetate is not formed. So I was representing it in a reverse manner so that it will becomes your mechanism of action. Now here I have indicated you disulfiram, and the word simple word taking you that it is acting on. So what should we write? We should write it as acts on. So actions on absorption of alcohol and metabolism of alcohol. Why? Because aldehyde dehydrogenase is present in enzyme both in absorption part and the metabolism part. So once we block this enzyme, we can stop both the absorption and both the metabolism. So we are writing that step as absorption of alcohol and also on metabolism of alcohol. So what it is blocking, as we already discussed about here, it is blocking your aldehyde dehydrogenase. We indicated here and we can write it as in the brackets ALDH, nothing but aldehyde dehydrogenase. And so what it is doing, once it is entered and the blocking of this enzyme, so this part is being blocked off. That means the acetate is not but the acetaldehyde is already formed in the blood, and we know that it is directly entering into your blood circulation and later which enters into your neuronal part. That means the symptoms are already entered into the blood circulation. So this acetaldehyde, when it has been blocked off, the acetaldehyde already present in our body is being present in a increased manner, and this is always depend upon how much alcohol we consume, whether it is between 350 ml or 1 ounce of a glass or 1 glass of a glass or 3 glass or 4 more glasses onto there. That depends upon the presence of acetaldehyde inside the blood. So once it is being blocked off, the acetaldehyde which enters into the blood, it may not be converted into acetate and start showing its symptoms like acetaldehyde syndrome. We know that the syndrome is nothing but showing various symptoms so that the person may be having some disorder relating to it. So once this blood enters into the blood, it is showing different set of symptoms. So what are those symptoms? The symptoms are perspiration, that means oversweating, throbbing, headache, malaise, diarrhea, chest, abdominal pain, chestness, that means the tightness in the chest. And these are the different types of symptoms that can be overcome by the patient, and that particular person or a patient can be said that he is having acetaldehyde syndrome. So what happens within 1 to 2 hours or in the gap of 2 to 4 hours, the acetaldehyde syndrome will be symptomized in the body. So what happens, the person or the alcoholic patient may not able to control his symptomize what he is happening onto it, and he feels so distressed and he started paining inside the body. And so what happens, once he says that, it happens that it is called as aversion of accepting. So what is aversion of accepting? We are not having the aversion of taking one more peg at any time in our life. Why? Because once we accept this, the blocking of disulfiram with the acetaldehyde has been happened, and the symptoms may be symptomized, and that symptoms will give you more pain rather than the pleasant activity what the alcohol is given. So what happens, because of the symptoms what we understand over here at this stage, it is giving you a word called aversion. Aversion means irreversible symptoms. We can't control those symptoms once we take that disulfiram tablet. And so it is called as aversion of accepting in the form of a disulfiram. So what happens, this patient or the alcoholic patients will feel so confused not to take the alcohol in a lifetime manner. So this is always intended only to the patients who have a high determination of controlling not to have alcohol in a lifetime. But it is not meant for the patients who have been in the acute stage or in the limited stage, but it is only to the patients who are chronic and severe in their alcoholic. Why? Because it giving you more and more symptoms rather than giving you the acetal syndrome. So what happens, they should have to take a determination that he should not take his alcohol in the whole lifespan further in the journey what he does in the future. And so this is called as the action of disulfiram. So this disulfiram should be always given in a course manner. So what happens, it will have to start with 1 gram per day. That means the whole day is covered with 1 gram, and later it has been reduced to 0.75 on the second day, 0.5 on the third day, and 0.25 on the fourth day, which is being taking in a course like manner and started from first to the back. So once this has happened, the person get used to that drug and he stop taking the drink alcohol at any determination, at any cost of determination. So this is called of mechanism of action. Now we'll come to the side effects what it creates. Actually, seeing this acetaldehyde syndrome symptoms, the side effects are much more lesser when compared to these syndromes. So we need not worry about the side symptoms, but we can carry on once we have a determination. And the more and more side effects what we see are headache. Why? Because we are always tempted, and also some hangover stage. Why? Because we have started stopping at that place, and also the diarrhea, nausea and vomiting. And not only this as acting on acetaldehyde dehydrogenase, but it is also acting on to the alcohol dehydrogenase in smaller quantity, and also it is acting on dopamine dehydrogenase. Why? Because these are all acting on to the neurotransmitter neurons. Particularly we gave here the neural part which is acting on GABA, which is acting on glutamate, which is acting on 5-HT3, which is acting on dopamine. So the main cause is to reduce your excitation and give you an inhibition stage which is very pleasant and happy feeling to that particular person who has accepted at any time. Now this is the whole picture regarding your disulfiram, and just we'll see what this alcohol will do on to all the systems and cover the whole alcohol topic. Now let me start the topic with the different actions. Yesterday we saw the actions of disulfiram on different parts of the brain, and today we'll see what it is doing on other parts of the body, nothing but the pharmacodynamical part. So let me erase the board and give you a small picture so that you can understand how faithful it is doing the alcohol inside of our body. And yesterday we were discussing about that whenever the alcohol is taken in little amounts, it can't create anything. But once the alcohol has been started taking more than 3 to 4 ounces onto the day, the effect started increasing. So let me start. What is alcohol doing on CNS system? This is nothing but the central nervous system. What it is doing? Actually, we know that it is causing some depression. The main cause is to give depression and a pleasant feeling. So this is the action, what it is doing onto the brain. Right? And next we will see on CVS system. We know that the CVS system is regarding your heart. So what it is doing in the heart? It is not doing much activity onto the heart, but more and more doses are being increased. It reaches to the chronic alcoholic stage, where we can see increased blood pressure followed by tachycardia, and this tachycardia is acting on vasomotor center, myocardial vasomotor center, and once it is being increased, the doses are increased, we can see atrial fibrillation, nothing but erythromyces, atrial fibrillation, and we have, once the doses are being increased and it is accepted and it is been started resisted inside our body, it started giving you lower blood pressure. So this is the picture what we can see on CVS system. Now we will go for the next system on endocrine glands. This we already discussed in the brain. Why? Because the pituitary gland, which is present onto the brain, have some activities releasing some hormones related to progesterone and progesterone. And so what happens? The action of, that means the action of making a sexual activity will be increased, and the desire is increased, and ability is decreased. Decreasing ability. So this is a picture on endocrine glands. And now we'll see on skin what it is doing. On skin, it is always creating a condition called gastric vasodilation. And because of this activity, always it creates warmthness inside the body. Warmthness discloses outside, but in higher quantities of alcohol, this is reverse, and it maintains body warmth. This is the reason why in cold climate we always accept, if at all we are not able to control our cold climatic conditions, we reach to accept some alcohol, so that it provides warmth to the body. So maintains your body temperature or warmthness. It controls your warmthness inside your body. So this is the action on skin. And now go for the next one. What it is doing on kidneys. So we know that these kidneys are the ones which are acting as a part of outsiding of your water. So what happens, rather than taking alcohol, they accept much more water regarding this, and much more addition to alcoholic drinks. So what happens, the person is always having a condition called diuresis. And this diuresis may not be action on the renal function, but it is only just creating your diuresis part, and later it is giving you control, that means decreasing of your hormone called ADH. That means antidiuretic hormone is been much more inhibited, and only the function of diuresis will be happen. And sometimes whenever it is been increased, it reaches to renal dysfunction. So this is action on kidneys. And now we'll go to the next part on smooth muscles. We already discussed about this. Why? Because onto the heart we have muscles which is creating you high blood pressure, and in lower doses and decreased alcoholic percents, it reaches your lower blood pressure. So this is the activity on smooth muscles. And now we'll see on gonads, on reproductive system. Nothing but the action of ovaries and sperms. Reproductive system. As we already know that the increase of progesterone and increase of progesterone has been increased by the action of endocrine glands. So what happens? The ability of sexual may be reached. But the thing is, sometimes into the higher nature, it creates impotence in men. It creates impotence in men and gynecomastia in women. Gynecomastia in women. This is when increased alcohol has been taken for the chronic patients, and this is the onto the reproductive system. And next we'll go for respiration, nothing but your lungs. So once you have the tightness in your chest, we always have a breathing exhale in action, and so we can see that there is lesser inhale and exhale, bronchoconstriction, so this is the thing happens onto the respiration part. And now we'll go on kidneys, on liver. So we'll jump to the next part on liver. We know that the alcohol is being metabolized from 10 to 20% onto the liver, where it is performing the actions of enzyme called cytochrome 452E1, and here onto the liver it is having the collapsing of metabolism, and the toxic metabolites are being released, and also we can see that the person is having pancreatitis, protein metabolism blocking, protein metabolism decreased or blocked off. Next you will have the decreased activity of metabolism and the release of metabolites, which are toxic to the blood circulation, with increased body weight. Why? Because the performance of adipose tissues relating to fat metabolism is being disturbed. So increasing body weight, fat stenosis, liver cirrhosis. So these are the different types of symptoms we can see onto the chronic alcoholic patients onto the liver. So we can see different types of actions onto the whole organ of our body, or all the organs in our body, how it is maintaining with the type of alcohol, whether it is in lower doses onto the higher doses. Once we see this picture, we can understand that the minimum use of alcohol will give you the perfect answer, and also in a higher doses will give you in a chronic conditions where it leads to toxicity. Here I want to add one more point. What it is that in lower doses of alcohol, the LDL conditions are reduced. That means it is lethal. It is reducing your lethal lipodensity proteins, and it is increasing your HDL, nothing but the good cholesterol. But the reverse is the function. Whenever there is increased doses of alcohol, it is giving you in a reverse action, that is, it is increasing your LDL quality, nothing but the lethal lipodensity. Here we can understand this is lipo, but we always remember that L stands for lethal. It is not good for your health. It should be always in a limited conditions and lower conditions. So we can answer that it is a lethal. Lethal means danger. And so in a reverse condition, whenever the alcoholic chronic patients have been taken, the reverse condition is seen, where if the increases of LDL is being done and also the decrease of HDL is seen. So this is the picture we can see onto the all the systems of the part along with your alcohol consumption. So this is a little small topic on alcohols and disulfiram. Please do subscribe to my channel. If at all any topic has to be dealt onto the board, you just make onto the comment section, and I'll make my time to give you a particular topic onto the board, so that it will be easy for you to understand. Thank you for the class. Bye.